Mental health and post-pandemic stress. A deep look at the emotional aftershock of COVID-19. The COVID-19 pandemic was not only a physical health crisis, it was a global psychological event. From lockdowns and isolation to economic uncertainty and grief, the world experienced a prolonged period of stress that reshaped how people think, feel, work, and relate to one another. Years later, experts, including those cited by the World Health Organization, continue to warn that the mental health effects of the pandemic are still unfolding. The silent emotional wave. During the height of the pandemic, anxiety and depression surged worldwide. According to the World Health Organization, global cases of anxiety and depression increased by more than 25% in the first year alone. But even as infection rates declined, emotional recovery has not been automatic. Many people continue to experience persistent anxiety about health and safety, social withdrawal and reduced social confidence, burnout from prolonged stress, financial-related stress and job insecurity, grief from losing loved ones, difficulty concentrating, and reduced motivation. For some, the world never quite returned to normal. Long COVID and mental health. A growing area of concern is the link between long COVID and psychological distress. Research shows that people experiencing lingering symptoms like fatigue, brain fog, chronic pain are more likely to develop depression and anxiety months or even years after infection. The relationship is complex. Ongoing physical symptoms, increased stress and frustration. Inflammation may affect brain chemistry. Reduced ability to work or socialize impacts emotional well-being. The body and mind are deeply connected, and recovery in one area influences the other. Young people hit hard. Young adults and teenagers were among the most affected. School closures, disrupted milestones, and social isolation occurred during critical developmental years. Studies show that many young people now report increased social anxiety, difficulty focusing, emotional numbness, sleep disturbances, reduced resilience under stress. Mental health professionals describe this as a developmental interruption, where normal growth processes were paused or altered by prolonged crisis. Workplace burnout and emotional fatigue. Remote work blurred boundaries between home and office. Healthcare workers, teachers, and frontline employees experienced severe burnout. Even now, many workers report reduced job satisfaction, chronic exhaustion, emotional detachment, decreased productivity. The pandemic changed workplace culture permanently, bringing greater awareness of mental health, but also exposing long-standing systemic pressures. Social reentry anxiety. As restrictions lifted, many people struggle with reentry into public life. Crowded spaces, travel, and social gatherings triggered anxiety. Some individuals became more comfortable with isolation and found it difficult to reconnect socially. This phenomenon, sometimes called resocialization stress, shows how prolonged isolation reshaped comfort zones. Is it getting better? Data suggests mixed outcomes. Some populations show gradual emotional recovery. Others, especially vulnerable groups, continue to struggle. Access to therapy has increased through telehealth. Conversations around mental health are more open than before. The pandemic may have permanently changed how societies view mental wellness, pushing it from the margins to the center of public health discussions. Coping and recovery strategies. Experts recommend rebuilding routines slowly, prioritizing sleep and physical movement, limiting exposure to distressing news, strengthening social connections, seeking professional support when needed, practicing mindfulness and stress reduction techniques. Recovery is not linear. It is gradual and deeply personal. A new era of mental health awareness. The pandemic exposed global gaps in mental health systems, but also accelerated innovation. Teletherapy, digital wellness apps, and community-based support systems are expanding worldwide. Mental health is no longer seen as secondary to physical health. The crisis revealed one clear truth. You cannot separate emotional well-being from overall health. Kindly like, share, and subscribe for more wellness tips. Disclaimer: please note, this video is for educational purpose and does not substitute medical advice.